You'll be the leader, that is the person whose name is at the top of the organization chart, but that you can be someone that can lead from where you are, influencing your organization in a positive way to influence others in the organization, other members of your team, and certainly if you're in the clinical setting, to impact in a positive way your patients that you want to care for. So we're very proud of the tradition here, the opportunity to come to Purdue. We're also very proud that we continue to maintain our commitment as one of the most affordable, if not the most affordable, of the top 10 pharmacy programs in the country. Purdue's commitment to holding tuition constant now going on 10 years. Our PharmD program tuition is the least expensive of any of the top 10 pharmacy programs. And we know that our graduates graduate with the least amount of self-reported debt when they leave our program. So tremendous opportunity for employment, a great opportunity because you'll have some of the lowest debt of any of the top programs in the country. And so that commitment to an affordable pharmacy education is important to us. I think that's also highlighted by our strong commitment of our alumni to provide scholarship support. Last year or 2 years ago was the first year that we were able to award over $1 million in student support for the very first time. And we've been able to continue to do that. And so there's rich opportunity for support here in the college as well. So there are many opportunities here. We hope that you'll join us. When you do join us, you'll have the opportunity to develop relationships with faculty, fellow students, alumni, to explore those careers and to find your path forward in pharmacy or the pharmaceutical sciences. And so with that, again, thank you for letting me be with you. I'll be happy to answer some questions if you have some questions for me. But at this point, I'll turn it back to Mrs. Pedley. You're muted.
Thank you. Thank you, Dr. Barker. I appreciate your time and I appreciate your positive message to these students and their families. I've got a couple of other advisors here on the call, and I have at least one of our students that are here. I know you probably want to hear from the students way more than you want to hear from me. So if I could ask the advisors to introduce themselves, and then I'll ask the students. Mrs. Schroeder, if you want to go first.
Sure. My name is Brenda Schroeder, and I'm one of the academic advisors here in the college. And I'm looking forward to speaking with you tonight. And I hope that some of you will feel brave enough to turn your cameras on. It's always nice to see your faces. So we hope you'll do that. And Ms. Eberhardt, who's going to introduce herself, and I will both be kind of trying to keep notes in the chat for you. So if you want to ask a question via the chat, we'll be monitoring that and trying to answer your questions.
Hi, everyone. My name is Megan Eberhard. I'm another academic advisor here in the office. The other thing that I do is I oversee our living learning community. So for any of you that might be interested in a community with other pre-pharmacy students, I'd be happy to answer questions about that for you.
Thank you. So like Mrs. Schroeder said, we will monitor the chat. If you guys have questions, feel free to send them to everyone, or if it's more of a private question, you can privately message myself or Mrs. Eberhardt or Mrs. Schroeder. We also I want this to be relatively informal. So if you're comfortable, you can just unmute yourself and just ask a question, and that is just fine too. That's not going to disrupt us. So we want to make sure that we're talking about what is important to everyone here. So I just got a message from one of my students. He is running a bit late and will log in any second. But if Hallie, if I could have you introduce yourself, if you could share, obviously your name, where you're from, and then talk a little bit about why you chose Purdue and why you chose pharmacy.
Absolutely. So my name is Hallie Froge. I'm a second-year pre-pharmacy student, and I'm from a small town about 35 minutes off campus called Williamsport, Indiana. And I chose Purdue because when my family and I needed to go get groceries, we always had to drive through Purdue to get to anywhere that had anywhere bigger than a small, tiny little grocery store. And I remember telling my mom when I was little, I'm going to go to school there. And I didn't know what college was at that time, but I knew that it was once I got older, I knew Purdue was for me. And I chose pharmacy because when I was in elementary school, my mom was going back to college. and for nursing. So I was always trying to help her with homework, even though I had no clue what college nursing homework would be like. And I remember being extremely infatuated with the medicine side of nursing. So I later found out what pharmacy was and started taking classes in high school that would help me on my road to becoming a student at Purdue Pharmacy.
Thank you very much. I do not see Mr. Hornfeck yet. So what I think I might do is while we're waiting for him to log in, Hallie, could you talk a little bit about, and I understand that you might change your mind 7 more times, but if you could talk a little bit about what you think your future will look like with your degree.
Absolutely. So, like I said, I'm from a small town and my town does not have a pharmacy in it. So, long-term goal is to open my own pharmacy, but I know that straight out of college, that is not something that normally happens for a pharmacist. So, I hope to work in like a retail setting, but I have not yet known how a hospital pharmacy runs. So, I'm anxious to get past COVID and be able to start shadowing pharmacists in the hospital setting.
Great, thank you. And I see Matt Hornback has joined us, which is amazing. So Matt, if you could please introduce yourself, share your hometown, why you chose Purdue, and why you chose pharmacy.
Okay, yeah, sorry I'm late, everybody. But yeah, like Mrs. Pedley said, my name's Matt. I'm from a small town called Mars, Pennsylvania. Which most of you would probably know Pittsburgh a little better. It's about 30 minutes north of there. So out of state student. So I chose Purdue. Kind of a funny story, I guess. Actually, my mom graduated from IU, and she wanted me to check out her alma mater, and we decided, well, we're in the area, so we'll check out Purdue while we're at it. And I ended up just loving campus here. Just kind of felt like it would be a great home for me, and knew I wanted to do pharmacy. IU doesn't have a pharmacy school, Purdue does, so that kind of made the decision pretty easy. And so yeah, I just kind of followed that gut feeling, chose Purdue, and haven't looked back since. And pharmacy specifically, I guess in high school, looking back, I was a big fan of all my science courses, and so I think a lot of like work with youth group and stuff too kind of helped inspire passion in me for helping people, and thought healthcare would be a great way to kind of combine those two passions. And I think I chose pharmacy over something like a doctor because I didn't want, I wasn't I guess a huge fan of the blood and guts type stuff that I guess you would associate more with doctors. And so pharmacy seemed like a great way to kind of get that middle ground, I would say. Is that all the questions?
Yes.
Okay.
Yes, thank you. So, and it's interesting, Matt, you brought up about why pharmacy over medical school, and I see a question in the chat about that too, and I'd like for Hallie to address that. But before she does, I wanted to just give everybody kind of a brief overview of the 2 majors that you can choose within the College of Pharmacy. So both Hallie and Matt have been talking about the PharmD, which is our 6-year program. You do 2 years of pre-pharmacy, then you apply to pharmacy school, and then that is 4 years of pharmacy school. You graduate from Purdue after 6 years with a doctorate degree. So you have a PharmD, you would be Dr. Smith after 6 years at Purdue. The other program we offer, we call it BSPS, stands for a Bachelor of Science in Pharmaceutical Sciences. That is our 4-year degree, and that is to focus more on drug discovery and drug development. So if you think that you want to be the person to cure cancer, to cure Alzheimer's, you want to take a current drug and make it work faster, make it less painful. All of those things are centered around drug discovery and drug development. And that's what our BSPS degree is. So just as you're listening to the students and advisors talk, just so you kind of understand the different paths that are available to you. So Hallie, I'm going to let you talk a little bit more about your choice between pharmacy and other medical careers?
So like Matt, I do not like the blood and guts type thing. I have 4 younger siblings, and when they would come to me with like a scraped knee, I'd be like, okay, mom's over there. I can't help you. That's gross. But I knew I loved helping people. So when I was in 7th or 8th grade, I had a college and careers class, and someone came in and talked about pharmacy. And I was like, that sounds like the perfect mix of like medicine, but also being able to help people without having to see them with a broken bone or something of that sort.
Yeah, it's interesting. A lot of times when I talk to students, and Mrs. Schroeder, Mrs. Eberhard, you might have thoughts on this, or even Dr. Barker, when I talk to a student and we kind of talk about what drew you to pharmacy, almost always I hear, I really like the idea of helping people. I like the idea of healthcare, but pharmacy is really clean. Like both of the students said, there's not a lot of blood and guts. There's not a lot of bodily fluids. Rarely are you going to have a 2 or 3 a.m. emergency. So and at Purdue, in 6 years, you have that title of doctor. So that is really attractive to students that don't want 8+ years of medical school or don't want those emergency or blood type careers. So it's interesting that you guys said that, because I hear that over and over and over again. Before I go on, does anyone have any questions that they want to unmute and ask right now? Or Mrs. Schroeder or Mrs. Eberhard, are you seeing anything in the chat that could be addressed? No, okay. Oh, I just saw a question about a laptop. Do you guys want to talk about what you use and what you would suggest?
Yeah, I personally use a MacBook Pro. I've never had any issues with it. It's worked really well for me. I'm pretty sure like we're mainly just using PowerPoints or like PDFs for notes usually. So yeah, comes down to personal preference, I would say overall. I know a lot of people in my classes like to use like either like a Microsoft Surface, or the iPad now has like the Apple Pen, so they can like write on the PDF files right on their screen, so they don't have to print anything off. So that's an option as well. I don't know what Hallie has, but
I also have a MacBook, but I use an iPad as well. So with courses being mainly online the past few semesters, it's been really nice to be able to download my PowerPoint slides onto my iPad and be able to take extra notes while I'm listening in class. But I have multiple friends who use PCs and they love those as well. So I think it really does come down to just personal preference and what you're more comfortable using.
I would also say, usually we hear from the ITAP and other items that doesn't matter if it's PC or Mac, get as much memory as you can, because that's going to serve you as well. So whatever the most memory you could afford is probably the best thing that you can purchase.
I've heard that exact same advice. Yes. So I'm seeing a couple of questions in the chat. One about job outlook, one about what does pharmacy have that distinguishes it from other, or what does Purdue have that distinguishes it from others, and the application process. Oh, you guys are doing great asking all these questions. I will talk a little bit about the application process and then let the students kind of talk about what their experience was. So it is 2 years of pre-pharmacy coursework during your fall semester. So the first semester of your second year at Purdue is when you will be completing and submitting your application to pharmacy school. So you will not have been at Purdue very long by the time you apply. And there is an application process, much like what you did to get accepted to Purdue is what you will need to do to get accepted to pharmacy school. The one main addition to what you did to get into Purdue is we will ask that you have some shadowing experiences. We want to make sure that you understand what is like a typical day in the life of a pharmacist. Is this a good fit for you? Do you see yourself doing this? And we want you to be able to speak intelligently about your future career. So you submit your application during the fall semester of your sophomore year. You will then interview early spring semester, your sophomore year. So the students that are currently going through the application cycle, they just had their interviews a few weeks ago, and they should be hearing their admission decision in the next week or two. So that's kind of the timeline of how it works. And I know Mrs. Eberhard and Mrs. Schroeder and I, every time we are meeting with our pre-pharmacy students, we are asking them to talk to me about what is your application looking like right now? Let's talk about your grades. Let's talk about leadership. Let's talk about community service, because we don't want it to be a secretive process. We don't want the application to feel like a mystery. We want our students to feel like they are an expert in their own application. So we are working with our students constantly about the expectations to make sure that they know what they're getting into. Hallie or Matt, do you guys want to talk a little bit about your experiences?
So actually, I did not apply my fall semester due to some personal circumstances and especially COVID. I opted to take a third year of pre-pharmacy, so I'm just taking kind of a gap year before I decide to apply to the program. And that is still on my list of to-dos. I'm not giving up on that, but I just decided it would be better to take an extra year and take some extra courses and get ahead of the ball game.
And that, sorry, Matt, before you speak, that is a very much a doable option. We see students doing that every year for lots of different reasons. Maybe they want to slow down and not cram a bunch of stuff into 2 years. Maybe they want to make sure that this is the right fit for them and they're just going to take a little bit more time. So absolutely, that is an option. And all you need to do is talk to your advisor and we can come up with a plan that makes the most sense for you.
I also know that earlier in the chat, we did have some private questions about students who might be interested in doing a dual PharmD and BSPS degree. That's very challenging to do in 6 years, but for those students who choose to take 3 years and do their pre-pharmacy, that's much more manageable. And so we do see a number of students that if they spend 3 years taking pre-pharmacy coursework, adding that degree along with the PharmD is much more achievable.
And then I can just go ahead and talk a little bit about my experience with the application. It's been about, I think, a little over 2 years since I applied. I'm a third-year student, so it has changed a bit. But like Mrs. Pedley said, I think it's just, the main focus and the great thing about Purdue is that they pretty much tell you exactly what you need to do. They give you these puzzle pieces, like she mentioned, job shadowing. You have the academic side of things, the leadership side of things, the organizational involvement side of things. And so they kind of lay it out for you, like these are the requirements that you need to get admitted into pharmacy school. And as long as you take the time and are intentional getting all those things, it's really not, for me at least, it wasn't very stressful. And so I think, Purdue does a really great job. And the good thing too about Purdue is, starting your pre-pharm year, you're going to have your academic advisor in the College of Pharmacy. And so they're just such a great resource to help you out with any questions about the application you have, or about pharmacy school, or just anything, any doubts you're having, so just a great resource, and just a great person to have on your side for sure.
Yeah, thank you. Do you guys want to, if we could just kind of switch gears a little bit here, do you want to talk a little bit about some of the clubs that you're involved in and kind of how you find that work-life balance? Hallie, do you want to go first?
Yeah. So I am also involved in a professional sorority called Sigma Alpha. It's an agriculture sorority. I grew up on a farm, so I wanted something agriculture. When I was on the academic side of campus, I was not seeing anything ag-related. So that's a nice balance. I'm also involved in Pharmacy Student Council, and I'm the vice president of that currently. And it's a lot of work managing 3 clubs, and I also work, I have a job, and then I also have classes. So it's hard finding a balance between everything, but I just live by my planner. I write everything out, all my due dates, like at the beginning of the school year for the rest of the semester. So I know what it needs to be done on what days. And it's worked out pretty well so far.
Yeah, so I right now the only couple clubs I'm involved in would be Purdue Pharmacy Ambassadors, which Hallie and I are a part of, talking to you guys here today, and then ROCI, which is academic society within the college. But when I was pre-pharmacy, I did a lot with Boiler Gold Rush, which is the orientation programs at Purdue, and so just got the chance to help out, with incoming freshmen and lead them around campus, which I really, really enjoyed. And then also was in Greek life on campus too. So not a professional fraternity like Hallie, but a social fraternity. And that was really helpful for me, just being, out of state, not knowing anybody coming in, and just a really great source of community there, especially not being in pharmacy yet and not necessarily having that community. It was really great for me just at Purdue in general. I think that's it. I know I just really enjoy, Purdue athletics too, and going to all those games. That's always a really good time too. In terms of time management, I guess is the other part of that question. I keep a calendar on my computer. And like Hallie said, it's really great to have like the syllabus or the syllabi when the semester starts, because they give you all the due dates. So you can just go ahead and mark those in. And it's just really, really good to be able to get them out of your head and kind of onto paper, so you're not constantly having to think about, oh, what do I have to do next? And yeah, I just want to encourage you. There is definitely time to do stuff other than study and get a pharmacy degree. So not to scare you guys, but it does take a while, but if you do your time management, you can definitely make the most of your time here.
Thanks, you guys. Mrs. Schroeder or Ms. Eberhard or Dr. Barker, do you guys have any thoughts to share about some of the questions that are coming in? Is there anything that you want to add?
Yeah, I'd like to make a comment about, someone asked about the distinction of Purdue Pharmacy from other top pharmacy programs. And first, I would say there are some really, really great other pharmacy programs out there. And you can look up the U.S. News and World Ranking programs, all of the programs on that list. I know them well and are tremendous programs. But I think one of the things that really stands out for me for our program is, again, this concept of the Purdue Pharmacy family, that you're coming to a big campus with lots of opportunities to do the things that the students have talked about, but you're also part of a smaller college where you'll get to know people and you'll get to know the faculty. And so you really get the best of both worlds. I think the other thing to look at when you look at other pharmacy programs is, do they have a relationship with a world-class health science center or medical center? And we have a strong relationship with the IU School of Medicine and the Health Science Center in Indianapolis. Most of our clinical faculty are on staff or shared faculty with either Methodist Hospital in Indianapolis or Eskenazi Hospital in Indianapolis. And so there's a strong relationship with an academic health science center. I think that's really important. The other thing to look at is the opportunity to engage in research, which as a Research One university, you'll have that opportunity at Purdue to give you a different experience in the pharmaceutical sciences. And it can be in the basic sciences, it might be in the clinical sciences. And so you have the opportunity, because of the diversity of disciplines in the faculty, to explore a whole variety of different research opportunities. Our hallmark is again, I've mentioned it earlier, is about really preparing leaders to lead in the various industries, and really, again, to pursue diverse careers. Someone asked about the job market. Our students continue to do exceedingly well in job placement. Probably one of the biggest indicators to think about is success in the highly competitive national residency program matching. We usually have right at the top in terms of the number of successful individuals that match with the residency program. And we have a very large number of our graduates that decide to go on to residency and are successful. They are highly sought after as graduates of the Purdue College of Pharmacy. We also are now seeing more and more students taking direct fellowships with industry. and a growing number of industry positions. And we have great relationships with our industry partners. We have the largest of the industry pharmacist organization student chapters in the country. So again, an opportunity for diverse careers, success in terms of matching with the residency program. And then our community pharmacy partners, our hospital pharmacy partners, certainly think very highly of our graduates, and they will be sought after for employment.
Thank you, Dr. Barker. One thing that I thought of that sets Purdue apart, we have it's called a 2+4. So 2 years of pre-pharmacy and then 4 years of pharmacy school. That is quite unique. The majority of pharmacy schools do require a bachelor's degree. So for us to offer that degree in 6 years, that is 2 less years of tuition, 2 more years of being in the workforce and getting that income. So that's a great benefit to students. We also have a community pharmacy right on campus, right in our building. And students during their year of pharmacy school, they work in that pharmacy as a class. So I don't want students to think that they have to have experience working in a pharmacy to be a competitive applicant. We will teach you everything that you need to know starting your first year in pharmacy school. If you do have that experience, that is amazing and that is great to have, but don't feel like you have to have that to be competitive. And that pharmacy is open to students, faculty, staff, and the community. So you're going to see all sorts of patients working there. Matt, do you want to talk a little bit about your experience working in the pharmacy?
Yeah, so that was actually the first time I ever worked in a pharmacy was as part of that rotation that Mrs. Pedley was talking about, the first year in pharmacy school. And so it was just a really great way to be introduced to, I guess, the workflow that a pharmacist would be doing without all of the high pressure situations you could potentially find yourself in. And it was just overall, I would say, a great learning environment. Like it was me and I think 3 other students were back there, and there are 2 TAs, and so you get a lot of great one-on-one time with them, and get to talk about the drugs we're learning in class, and just practice our counseling with them. And then you'd go up to the front, and an older student would be with you there too, and you would get to counsel an actual patient and talk to them about their medication, and with the comfort of knowing there's someone right there next to you that knows what they're talking about in case you slip up. And so it's just a really, really great opportunity, and really just great learning environment that I think I really appreciate it. I am excited too, because I'm actually going back, starting rotations next year for me. I'll be working in the pharmacy here for another, I think, like 3 months. So I guess I liked it that much. I wanted to go back, but.
Awesome, thank you. So Matt had mentioned rotations. So the way pharmacy school is set up is your first 3 years, you are in the classroom. Your 4th year, you are on rotations, which is basically on-the-job training. And you do 10 4-week rotations. And Purdue offers lots of different opportunities. So we offer a few international opportunities. If you wanted to do rotations, we offer a site in Kenya. We have a site in Colombia. We have a site in the UK. This isn't international, but we have one in Alaska. So really neat opportunities. If you guys wanted to do some sort of study abroad type experience, that is available to you during your P4. So P1 is your first year in pharmacy school. P4 year would be when you do your rotations. Matt, have you gone through that process for selecting rotations, and you want to talk a little bit about that?
Yeah, so I have kind of how it works is so P3 year, which is the year I am, we rank all of our rotations, and there's just a big list, and we can separate them by region and by type of practice site. And so there are like 5 specific kind of practice sites that you have to do, and then there's some elective ones that you can do. So there's a lot of cool fun ones, like Mrs. Pedley mentioned, going abroad. But I rank them back in a few months ago, and we're going to find out here, I think in the next few weeks, where exactly we're going to be placed. And so pretty exciting, pretty nervous, but yeah, it sounds like a lot, but they did a really good job of like walking us through how to rank and, you know, the deadlines for that and what to look for in rotations.
Thank you. So Mrs. Eberhard, when you introduced yourself, you talked a little bit about how you're in charge of the learning community. Do you want to share a little bit about what a learning community is and what to expect?
Sure. So there's basically two different kinds of living learning communities on campus. There's one like ours that's more based on you're living with students of the same major. There's also ones that are basically students grouped by the same interest. So for anybody that's considering the pharmaceutical sciences degree and you have an interest in data or research, there's the data mine learning community, and that's for all students interested in research. So that's a really good option to look into as well. As far as the pre-pharmacy one goes, students are currently living in the Owen Residence Hall, which is close to our building. It's also close to the Ford Dining Hall, which a lot of students think is one of the better dining halls on campus. We, in non-COVID years, would do weekly floor dinners with our students. We offer events to better explore pharmacy as a career. So one of the events that we're doing next week actually is a compounding event. So we're going to walk students through, okay, you've received this prescription from a doctor. He's written out the ingredients for it because it doesn't exist on its own. And then we measure out all the ingredients and compound it together. We're also going to have some P4 students with us. We're going to talk about their experiences so far in their rotations. So it gives you a lot of exposure for asking those questions of current students who've already gone through all of this process. But it also gives you a chance to be with students who are in all the same classes as you. It's a really great opportunity to ask questions. If you're stuck on a homework problem, you can just go down the hall and say, hey, have you done this yet? One of the stories we like the most is, you're all in the same classes, so you have exams at the same time. You're all getting ready to leave and you notice, Susie's not here. She's overslept. Let's go run down the hall, grab her, make sure she's not late. So it really just gives you a chance to have that community and, build up those friendships and have those resources to make sure that you're all staying on track and going forward together.
Great. Matt or Hallie, did either of you do a learning community? No.
Yeah, I did my freshman year. I would just second everything Megan said. It was, again, being out of state, it was great to just have a source of people to get to know and just find people to study with that first year. And I think a lot of the people I still met, I actually still sit with in class. So definitely relationships formed there that withstand the test of time. So definitely a great option.
So I'm having a hard time keeping up with all the questions. Can Mrs. Schroeder or Mrs. Eberhard, is there anything that would be helpful to share with the group?
I had two questions that I popped up that I'm going to send out. One question that was asked was about how COVID has kind of affected classrooms. And I do know that in the fall, we're hoping to be much more in person and have a lot of that going on. But I still want the students maybe can address what their experience has been like in their classrooms. And then I know there was also a question about what's the up-to-date lab technology. And I'm hoping Dr. Barker can help us with that. Dean Barker.
And actually, before the students answer, Dr. Barker is on the Protect Purdue task force. So if Dr. Barker, if you don't mind addressing both of those, I think that would be really helpful.
Yeah, so as many of you may know, Purdue made the decision very early in the whole pandemic back probably in April of 2020 that we would pursue resuming residential instruction in fall of 2020. And we did that with de-densification of our classrooms. Largely in the College of Pharmacy, our classes were offered in person. We had a couple of examples where faculty were in the most vulnerable category and we made the choice to not bring them into the classroom. As we moved to spring of 21, we took another step forward in terms of residential instruction. And again, As far as I'm aware of, all of our courses are offered as residential courses. We do have the hybrid versions where people can view content online. And then really our intent for fall of 2021, barring any changes in what we know about the pandemic, is we'll take another step forward in redensifying our classrooms. Probably we anticipate face masks being retained as a protective measure. But as we anticipate the rollout of vaccinations for individuals across all age groups, particularly college age groups, the opportunity to protect the most vulnerable will be in place. And again, unless there's some major change, we anticipate being able to resume another major step forward towards what we will consider, probably at least for the near future, the new normal for operation. But we anticipate being back with football games and basketball games and other activities on campus in the fall. Again, but we are constantly monitoring the most up-to-date science and medicine on COVID-19. And if there are changes that we need to make, we'll obviously make those accommodations. I think there was a question about technology in our classrooms. First, I would say in the Purdue Pharmacy, we were talking about that very recently. We received over $1 million donation from one of our alumni who is leading an effort for automation in community pharmacy. And we've now installed the most up-to-date robotics and automation in the Purdue Pharmacy. So our students actually get a chance to work with that automation that they will actually see in almost any of the community pharmacy practice settings. But within our instructional labs, we do have some use of simulators. We do have access to the simulation lab that is actually housed in the School of Nursing. And some of our courses do take advantage of the simulation center there, which does have the robotic patients. We also have faculty that are developing augmented reality and virtual reality simulations to be used in instructional environments. And so I think the combination of all of those are used as up-to-date technology for instructional purposes. One thing I will give a bit of a preview for is we do have on the books a plan for a new instructional space, the active clinical learning facility for pharmacy and nursing. It is the #1 capital request to the state of Indiana right now. We are in a holding pattern waiting to hear from the state legislature in terms of the state budget. But it is the university's #1 building request to the state. We have already raised over $25 million for the project. It'll be about a $100 million building that if we stay on the current schedule, we would anticipate opening in December of 2024. And that means that if you join our college somewhere during your PharmD years, you will help us move into this new facility. And so we're very excited about it, and it will have embedded in it all of the latest instructional technology, an expanded simulation center, an expanded pharmacy practice laboratory with all the cutting edge technology embedded. And so we're real excited about the active clinical learning facility for our campus, and particularly for our PharmD program. We'll have to keep our eye on what happens over the next couple of months in the legislature and keep our fingers crossed that the state budget projections look positive and they'll look favorable on capital projects as they head into late April and early May. And then we'll have a pretty good sense of what our timeline looks like. But somewhere in the distant future, not so distant future perhaps, there'll be some new facilities. And I think this incoming freshman class will have the opportunity to partake in instruction in those new facilities.
Thank you, Dr. Barker. I appreciate your insight. Hallie, I know Hallie has to go probably in the next minute. Do you want to just share before you have to jump off, parting words, piece of advice, what you wish you knew in high school that you know now, anything that you want to kind of share before you have to go?
Absolutely. College is not high school. I got all A's in high school, passed everything with flying colors, and I got to college and it was a big smack in the face. Not trying to scare you, but don't think it's going to be a big, you're going to ride just by and have a great, you have to work hard is pretty much what I'm trying to say. It takes a lot of hard work, but it's 110% doable. even though I do have to take or I am electing to take a third year, I'm still going to reach all my goals. And it may suck being in school for 7 years, but in a few years, I'll be a pharmacist, and that's what matters. So good luck. You guys will all do great.
Thanks, Hallie. I appreciate you.
Have a good night, guys.
Matt, do you want to talk a little bit about your experiences during COVID and kind of how your experience was with classes and on campus and socially?
Yeah, definitely. I think this semester has definitely been great. I know we had to switch lecture halls, but they have a room reserved for us now where they can fit our whole class, which has been good. I don't know if you talked about it at all, but once you're in pharmacy school, you take every class together with all 150 students that are in the program with you at the same time. And so I think Dean Barker talked about the pharmacy family. Like, you just get really close with the people in your class, and it was kind of a bummer to have to go virtual and kind of split up lecture halls during the pandemic just for that reason. And I know a lot of like social events and things like that had to get canceled. But I think just like Purdue as a whole and the College of Pharmacy has definitely adapted to it, and we found ways to still stay connected, like everyone. I mean, with Zoom and just keeping socially distanced, and definitely very, very excited to get back to normal. Hopefully next fall we won't have to be talking about this anymore, but I think we've definitely done the best that we can with what we've been given. So
Thank you. Mrs. Schroeder, Mrs. Everhart, is there any other questions coming in that we could address?
I think this one that just came in might be a good one to talk about. So they're wanting to know how our curriculum fosters real world experience prior to the P4 year when they're out on rotations.
So Matt, do you want to talk a little bit about your IPPE experiences and kind of explain what that is and how that has helped you?
yeah, so I think the question in the chat actually did say specifically hospital experience too. And so in January, I had a rotation. So there's your IPPEs and your APPEs. So it's introductory pharmacy practice experiences and advanced pharmacy practice experiences. And so the IPPEs are kind of built into the curriculum, more kind of in the name introductory. And so the one I had in January actually was 4 weeks working in a hospital alongside pharmacists, and just seeing what that kind of day in a life is for pharmacists, and even getting to do to work alongside them and do a lot of the things the pharmacist does under their supervision, obviously. But yeah, I think Purdue does a really great job of preparing you. And like I said earlier, you get to work in the Purdue Pharmacy, and then your P2 year, you work in a community pharmacy. And so they definitely do a really good job. And even in lab, we do a lot of practical work where we learn how to vaccinate, we learn how to take blood pressures, we learn a lot of over-the-counter medications and things like that, and just practice patient counseling. And so all the skills that you're going to need one day working out in the real world, you're going to get to practice before you do that in lab and on these rotations.
And Matt, you said you did not have any pharmacy experience, like working as a pharmacy tech prior to starting pharmacy school. When you did your first IPPE rotation, did you feel prepared?
I did, yeah. And obviously you're not going to know everything. I mean, that's the point. And so I think one big thing for me was just realizing, hey, this is an opportunity for me to learn. There's not really any sort of pressure on me to perform in any sort of capacity other than being professional and just showing I'm willing to learn and put myself out there and admit that maybe I don't know everything. And so it was really great. I think just being able, especially in this last one, being able to apply like what I was learning in the classroom to actual clinical decisions. And I felt with a little guidance from the pharmacist there that definitely that, the education I've received here so far has definitely prepared me for it.
Thank you.
We also have embedded throughout the curriculum interprofessional experiences. So students are doing that beginning their P1 year, where they're working and collaboratively making connections with some of the Purdue nursing students, as well as some of the IU medical students. So trying to kind of help them start developing that interprofessional relationship that a lot of pharmacists are going to be working with once they graduate.
Are there any other questions? Does anyone want to unmute or turn your camera on and ask a question? Nobody brave enough, huh? Okay. So I see we've got just a few minutes left, and I would ask, Matt, do you mind sharing where you think you will, or how you think you'll be using your degree? Like, what does your career look like today when you graduate?
Yeah, so that's definitely something that I'm still trying to figure out and kind of form that vision. But I'm very excited for rotations to kind of hone in where my passions are. But I think right now, my primary goal is to just be. I think when you think of like the classical community pharmacist, just being a member of the community. And I know Hallie had said that she wanted to open her own pharmacy one day. I'm definitely open to that. But I think just the idea, of working in kind of a small town pharmacy and getting to know the people that you're dispensing drugs to on a more personal level, and just beyond the walls of the pharmacy even, could be great. And just having an impact that way, because I think that makes it a lot more of a richer experience. And I think you can get that in other settings too, with ambulatory care, if you're working in like a public health clinic alongside doctors, or even in the hospital, just working, even like helping the nurses out there. So I think definitely just wanting to just connect with the community I'm working in a broader sense through pharmacy, if that makes sense.
Yeah, thank you. So one last question for you, Matt. What wise words can you leave everybody with, or what do you wish you knew? What suggestions do you have to share?
Yeah, so this is very cliche, obviously, but I think, time does fly. And just sitting here getting ready to go on rotations, I'm just thinking back, it feels like just yesterday that I was in everyone's shoes, all of your guys' shoes. And so, my advice would be, work hard, obviously, and do your best. And I think it's important to stop and look around a little bit and just try to enjoy where you're at, and try to enjoy these 4 years or 6 years or however long you're going to be here, because they honestly have been some of the best years of my life so far. And so that'd be my advice to you. And like I said, I don't mean to say, school is not important or anything, but just try to find enjoyment in school, even, and in your studies, and try to find a way to enjoy learning. I think that'll serve you well in the future, just going forward.
Thank you, Matt. We are almost out of time, and I'm going to put in the chat, unless Mrs. Schroeder, if you were going to do that, I'm going to put in the chat the email that goes to me, but then I can also send to a current student. So if you guys have questions after tonight, if you need clarification on something we talked about, if you want to get connected to a current student, which is always so helpful, just send an email to that email address, farmlife@purdue.edu, and we can follow up. And if you would like, we can set up another Zoom call. We can do a phone call. I can get you connected to a current student, whatever it is you need to kind of help get some questions answered or get some clarification to help you make this really important decision. Let me know how I can be helpful for that. So like I said earlier, I do truly appreciate the time that you all have spent with us tonight. it really does mean a lot. And I hope we were able to answer questions and get you some additional information to help you make this amazing decision. Thanks.
I would also let you all know that if, we've shared a lot of links in the chat. If you want to save chat, you can actually do that. If you go to the bottom of the chat link and those 3 little dots, it gives you an option to save that. So if you want to save that so you have access to those links, that's certainly something you can do as well.
Great, great advice. Thank you all so much. I appreciate your time. Have a great evening.
This is not about the pharmacy, but I'm trying to activate my career ID, but it's not working. So what should I do?
You mean you're trying to use your Purdue email?
No, I mean to accept my offer, I need to activate my career IDs. But so I put my birthday and something stuff, and it's not working at all.
Okay, so probably setting up your initial career account is what I'm thinking.
Yeah.
So I would say if you're continuing to have problems, if you've kind of gone through their list, there's a group on campus called ITAP, and that's probably the group you need to get in touch with. Let me see if I can put that information out there for you. I would reach out to them and let them know you're having issues with that. So hang on a minute.
Yeah, they have an email helpline, they have a telephone helpline, and they respond very quickly. Really
Okay.
getting back to students.
Oh, this is Everhard. To the punch. Thank you.
So Esther, I don't know if you can see it. It's in the chat right now.
Okay.
Did you have any other questions?
No, that's it. Thank you.
Okay, I appreciate you being here tonight.
Thank you.
Have a good evening.
I just noticed, I hate that when I look and realize maybe I've been private chatting somebody for a while.
I know, I hate that too. And I need to.
Really great message. I've been sending a lot of it to this Tanvi. Had a good one. I sent just to her, but oh well.
Yeah, I should not be saying you can private message me because I can't pay attention and read the chat. I just can't.
Yes, I know it. Then you sent me a message like, oh.
Yeah, okay. Well, that was very nerve-wracking having Dr. Barger sitting in. I was just gonna talk and then zoom out, but ooh.
And I'm glad he was there because I was like, I don't know what kind of technology we have in the
Right. He was actually super helpful. So
yeah,
that was good.
It was
Thank you guys. Have a good night. I appreciate it.
Bye.
Bye.